What we're going to do now is a injury assessment or a head to toe inspection. So what we're looking at here is somebody who's hurt themselves. We're not absolutely sure what has happened yet. So in this instance, they're conscious, and we're really just looking around to see what injuries they may have. So to start with, you've already gained consent. I've got my gloves on, ready to do the inspection. And this could be someone laying on the ground here. They could be sat up because it may be they've fallen, hurt themselves, and by the time you get to them, they're already sat up. But for this example, we've got someone who's laying on their back. The first thing to do is keep them there because it may be they have a spinal problem. So if we move them, then that could make it a lot worse, and that could be a very, very serious situation. So the first thing we're going to do is start at the head. So you okay?
Yeah.
Yep. So what we're doing there, we're trying to get them to talk, because in doing that, you can also look into their mouth and have a look to see if there's any obvious injuries. So from what I looked there, I can see his teeth are all in place and there's no blood, his tongue's not injured, and he can talk. So at least I know inside the mouth's okay. So then I'm doing a visual inspection around his head just to make sure that there's no injury there. Also put my hand down underneath his neck just to feel the spine gently, so you can feel the top part of the spine here to make sure there's no deformity, pain, discomfort or anything like that. Now the whole time you're doing this, you'll always be talking to the patient, so as you're doing each section, you can work your way through and just make sure that they can tell you if there's any pain. So just for ease of this, if there is any pain, he'll tell me, just for the ease of the training video. So we look through and make sure the neck's all okay. We're then looking across the top of the head, make sure there's no other blood or injury site. Make sure again, fingers underneath here, there's no blood on our gloves after we've touched them. Have a look in the ears, just to make sure there's no fluid, which could indicate a head injury. There's no discharge coming out of the nose, which could be again a head injury, or it could be the nose has been injured. And then the next thing to do is look at his eyes. So we're looking at the pupils. Look at the pupil size. Is it very, very small? Is it very, very large? Are they different? Is there any redness in the eyes? But also we look at the tracking. So keep your head still and just look at my finger and just follow my finger across. So what we're looking there is to make sure that both eyes are moving correctly, side to side and up and down. And they are, they're tracking exactly the same way. If you're not sure what size the pupil should be, you can always look at somebody else's, or put the camera back on yourself and have a look at what size yours are. Because in the same light conditions, your pupil size should in most cases be pretty much the same. So once we've done the eyes, we're then going to work our way down, and we're just really feeling the body to find out whether there's any problems. So we can start up here to check there's no injury, just let me know if anything hurts. And we're doing both sides so we can find out whether there's a difference. So if something feels slightly different on one side to the other, if I do it this way and then this, I might not notice it. So we're just working our way down, round, then down the collarbone, and then again down the breastbone. If you push down on here and there's any problem in the ribs, he'll soon let us know about it. So just gentle pressure, you don't want to push down too hard. Again, you can just push on either side to make sure there's no problems there. Follow the arms down. So with the arms, you can literally just work your way down, make sure there's no problems. Wiggle your fingers on this hand, and then do the same on this side and wiggle your fingers. So you know everything's okay with the arms. So it should be all okay. There's no swelling, there's no cuts, there's no bruising, no discoloration. Next we work through the lower back, so we go around into the small of his back, just pull through, see if there's any deformity, check your gloves to see if there's any blood on there, because it may be there's a serious cut on his back and he's just bleeding into the grass and we wouldn't even notice it. Probably wouldn't even come this side, I wouldn't see it because it's just going straight into the ground. Once we've done that, we can then just check the hips, just pushing gently on either side, just to make sure that there's no discomfort, because if there's a pelvic injury, then that will start to cause a lot of pain for him. And if you do detect a pelvic injury in this instance, you would need to stop the investigation then, because we've got serious injury, as you would if you found a spinal injury later on, earlier on up higher. Once you've done that, you can then work way down the legs. Literally feel the legs all the way down, on the front, the back, both of the legs. And if you wiggle your toes, and then pull your foot towards you, and the other one, and push away. Now the legs look straight, they're aligned in exactly the same way, the feet are in the same sort of position, so it doesn't look like there's any twist, because also if there was a pelvic injury, then that may mean that it pushes one of the legs off a line as well. So the assessment you're really doing is working your way through, depending on the actual injury. Maybe you don't think there's anything wrong, it's just really making sure there's nothing wrong in doing this assessment, and do it nice and steadily. If all is okay, then you can assist him gently to get up but the whole time just keep looking to see if there are any other injuries, and the whole time to see what happened, the mechanism of injury, you know, what put him into this situation in the first place.